here we go. Hello, everyone, and welcome to our virtual health symposium entitled How Lupus Affects the Hispanic, Latinx, and Native American Communities. My name is Kelly, and I am the creator and executive director of the Portland-based nonprofit, More Than Lupus. And on behalf of myself and everyone involved with More Than Lupus, we are thrilled to be presenting this forum in partnership with our West Coast patient advocates and industry partners, including California-based lupus nonprofit, Looms for Lupus, and GSK, as we come together to bring critical awareness to the often overlooked lupus in minorities health crisis. A staggering 2/3 of Americans know little or nothing about lupus, a disease that disproportionately affects women, and in particular, women of color. Additionally, Hispanic and Latinx and Native American populations are reported to have higher rates of disease compared to Caucasian populations. Why is this? Well, it's not entirely clear why lupus is more common and often more severe in these communities compared to the general population. And this needs to change. And it starts with having an open and informative conversation about these statistics and how, as a community, we can be a part of this change. That being said, let me introduce our co-moderator and community leader, Juana Mata. Juana is the co-founder of Looms for Lupus, a California-based nonprofit founded in 2011 by her and her two sisters. After being diagnosed with lupus in 2009, she and her sisters set out to learn more about the disease by researching and then becoming active lupus advocates and starting their own support group where they loom, knit it. That's where the idea of starting Looms for Lupus was born. Since then, the Mata sisters have actively worked in many parts of the country, including collaborating with Lupus LA, Lupus Research Alliance, Lupus and Allied Disease Association, More Than Lupus, the We Win Foundation, the House Foundation, and the International Support Fibromyalgia Network, along with other local and national organizations. They have also raised money for Lupus Foundation of America, Lupus International, and community organizations. Will you please welcome Juana Mata?
Thank you, Kelly. Good afternoon, everyone. I'm super excited to be here with More Than Lupus and GSK. Like Kelly mentioned, I was diagnosed with lupus 11 years ago. And because my sisters and I saw the need of awareness about lupus in the Hispanic Latinx community, Looms for Lupus was born. Not only for lupus patients, but also for their families and loved ones. Today, I am more than happy to be here to moderate with you as we delve deeper into the lupus minorities health crisis, and especially on how lupus affects Hispanic, Latinx, and Native American communities. Hola, buenas tardes a todos. Estoy súper emocionada de estar aquí con More Than Lupus y GSK. Como Kelly mencionó, me diagnosticaron con lupus hace 11 años. Y porque mis hermanas y yo miramos la necesidad de traer más concientización sobre el lupus, en la comunidad hispana latina, Looms for Lupus nació, no solo para los pacientes con lupus, pero para las familias y los seres queridos. Es un placer estar aquí hoy como moderadora en esta plataforma para hablar de lupus en las minorías y específicamente cómo lupus afecta a las comunidades hispanas, latinas y nativa americanas en la actualidad. Hoy tendremos varios presentadores. Nuestra primera presentadora es la doctora Cristina Lanata. Again, thank you everyone for joining us today. Our first speaker is Dr. Cristina Lanata. Dr. Lanata is a board-certified rheumatologist and an associate professor medicine at the University of California, San Francisco, where she has dedicated her research to unraveling the mysteries of lupus in minorities and examining health disparities observed with patients with SLE from a genomics standpoint. As an immigrant from Peru, who was both trained in the US and Peru, she brings a global perspective that influences her research agenda. The culture of equity and inclusion with the University of California, San Francisco, and above all, her patient care. Please welcome Dr. Cristina Lanata.
Hi, everyone. I'm so honored to be part of this wonderful event. Every time I get to have these conversations with all of you when there's space. Sometimes in the clinic, there's not a lot of space to talk about these important issues, and I feel very grateful, and I'm really humbled by all the efforts of so many people to bring this forward. So with no further ado, I'm just gonna share my screen with a few slides here. Let's see. Can you see the slides? Can everyone see?
Yes.
Wonderful. So I am basically going to briefly talk to you about what I've perceived through my years as a physician and as a researcher about the really striking differences of how one disease can look so different in so many different places. So as Juana mentioned, I'm from Peru. I did my medicine, my training back home. And this is one of the hospitals where I did my internal medicine rotations as a medical student. This is Peru, it's a third world country, and these were the wards where we trained. And in this setting, all my patients in these long wards where you get all your assigned patients were mostly women my age with severe lupus. And since then, I've been dedicated my life to understand this disease, what was going on with these young girls my age, and that was not going on in me. Why were they sick and I was healthy? And it really did strike that something was really wrong early on. These were young girls with severe lupus affecting multiple organs in their bodies. Et cetera, et cetera. So then I trained, I migrated to the US to receive the best of training I could get to understand this disease. And then I saw that lupus could look so different. It could be very mild. It has many phases and a wide array of manifestations. And sometimes it can be very, very mild, and sometimes it can be very, very severe. So that, as many of us really ponders, what makes the disease act in so different ways. And now we know that as most complex diseases go, it's this, perfect storm or combination of factors that makes every single patient with lupus unique and their own universe. And you are the ones that actually know this more than I do. But we think in a broad spectrum, it's a combination of, a genetic predisposition to the disease, the genes that you carry with you, that not all of them are going to, manifest into something, but it's a baseline risk that we all have. We all have a genetic, architecture, and it's there, but it's not enough. You have to encounter certain things. Something happens that triggers this event where disease starts. And it's a combination of, what your life has been, what have you been exposed? And it can be a range of factors, from like nutrition to smoking, to air pollution, to trauma, to, poverty, to just exposures to bad pesticides, to a viral infection, to a bad accident. There's so many things that can trigger the immune system to finally cause what we know as lupus. And all of it is also mediated, we think, under another layer between genes and environment that is called epigenetics, which is basically that bridge of how everything that you experience interacts with your genes, and then to cause some disbalance that causes you finally to break out in this disease. So it's that like perfect storm where all these things have to kind of align to bring out just the unique features of lupus that are in each and every one of us. And lupus, when we think about, well, who gets lupus and where and why, lupus is not as a common disease, as you know. It's not super rare. There's a lot of people with lupus. However, it's been really hard to study the true numbers of who has lupus, specifically also around the world. So we have better data in United States and Europe, but we really don't have a clear sense of how many people have lupus outside the United States and Europe. And the epidemiologic studies of lupus are really, really hard, but these are kind of like the best numbers that we have. And you see that they go all over the place, from like 1 to 23 in North America per 100,000 persons, to 4.6 to 6.3 in Central America, to 0.3 to 8.4 in Asia. So it's unclear. It does happen all over the world, but we really cannot tell you that we actually know the global incidence of lupus to a point where we can tell you how it affects different populations with accuracy. But we have a little bit of a better sense of that in the US because we have done a lot more studies here. So we know that self-reported ethnicity or self-reported race actually tends to be a factor in lupus risk. And we see this in particular with the African-American population. They have a 3 to 5-fold increased risk of lupus compared to individuals with more of a European ancestry or background. But not only that, but it's much more prevalent in patients of Asian ancestry or ethnicity, and also our Latinx or Hispanic population, which is a very broad term. And I'm the first one to recognize how broad this term is. So we're also counting all sorts of things there. But we know that when there's a certain component of Hispanic population, lupus is higher. We see it more frequently than in people that have more of a European background of self-reported white ethnicity. And we also know that the Latinx community and also the African-American populations develop lupus at a much younger age. So they start developing disease younger. So these are things that we know. We also know it's not only just lupus, it's like, how bad is your lupus? And as many of you know, we always are worried about the kidneys with lupus, and your doctors are always checking to see if you have kidney involvement, because that's one of the bad manifestations of lupus, and we want to preserve the kidneys as much as possible. So as an example, patients that have lupus nephritis, which is the renal manifestation of lupus, we see it happening at a much higher rate in patients that are from an African and Amerindian ancestry than patients that don't have that, and or patients more with a European ancestry. And in this very beautiful study, it was done in a research cohort in Alabama, where they had a very diverse group of patients, not only African-American, but Hispanic and also white. They saw that when they actually accounted for other determinants of health, such as socioeconomic status and also just genetic ancestry, they really still couldn't explain why this manifestation of lupus nephritis was happening at a higher rate. So we still can't fully tease apart what's actually driving these bad outcomes in certain communities or minority communities in the US. Our latest effort here in California, where one of my colleagues at the University of California, Dr. Dolera, really actually she went into this like really extensive effort of trying to document every single patient that had lupus in the San Francisco County. And she went to every single medical facility. So it was like really like a deep effort to try to understand what's going on. And what she found is that there was definitely such striking disparities in terms of not only the risk of lupus, but the risk of these bad manifestations such as lupus nephritis. And as you can see, this is a lot of data and graphs, but just to say that these are the numbers in terms of like the incidence of this disease. And as you can see, at least in California, it's much, much higher, just comparing the numbers of 30 to 5 from the incidence of lupus per 100,000 person years. And these are just the graphs of the numbers. And it is actually in California, we have also a high population of Asian women too that suffer from lupus. And these are kind of what we can say in terms of the disparities. And lupus nephritis as the outcome, you can see also that it really happens at a much higher rate in, actually in this case, in Asian women, followed by the non-Hispanic African Americans versus the Hispanic who are here. But again, people from European ancestry are protected from this outcome. So this is just actually data from last year. This is still occurring right now. This is not something that, we know from like a long time ago. These are still things that are happening on a day-to-day basis. Because I've been seeing lupus in so many environments and different places and exposures, I do want to talk about my research, which is trying to understand these disparities from a genomic standpoint, as Juana was saying. And there has to be said that genetics are really important. And sometimes what happens is some genes that were initially very, very beneficial now no longer serve us and actually are maybe creating some trouble. And the hypothesis is that these genes that were, conferring a really strong immune system way back when there were like pandemics as the one that we're facing, and that have shaped the evolution of humanity, that they were protective, they were protecting populations go forward in terms of evolution. Now, the immune system is so strong that it's now auto-reacting and now causing autoimmunity, where now we're seeing diseases such as lupus occur. So it's basically, we've gotten out of balance in terms of this selection of these genes. So the genetics is important. We know this. We know that genetics is really important for lupus. Having said that, it's not the entire story. And there's a lot to be done in terms of genetic studies to try to understand how these genes actually confer risk. But most of all, like, how can we actually think of therapies that act among these genes to actually treat the disease better? However, and I'm going to speak about this in terms of why we still don't understand how genetics plays a role in these disparities, is that most of the studies, and I want to say like 90% of these studies, have been done on patients of European descent. So we still just know one part of the story. We haven't actually finished telling the whole story of genetics, just because we really need to study everyone, and we still have a lot of work to do in that subject. And having said that, we do know that, for example, if we get all the genes that we know that are involved in lupus, and we get normal individuals, people without lupus, and we just get their genetic data, we know that the amount of genes that are potentially responsible for lupus are present just in normal people at a much higher prevalence in people with African descent, as we can see in this box plot here on the right. And it's a gradual decrease to patients that have European ancestry. So we know that the populations, our populations around the world, have selected certain genes because they were useful at some point in the evolution, and now they're prevalent at much higher rates in some populations versus others. And again, I just want to repeat, this is actually normal people without disease. So there's some evidence that there is a little bit of this balance in terms of the genetic predisposition for lupus according to what your ancestry is in terms of the populations that you come from. So there is that. We still don't fully understand it, but there is a component of genetics influencing this high disparities that we're seeing. And this is just to show that the reason that we are still working a lot in terms of trying to understand really the genetics, as I was mentioning, that really we haven't studied everyone. And this is just, and it's not just in lupus, this is just happening across all genetic studies of every single disease out there, that if we only focus on studying Europeans, we're only gonna get just that answer for Europeans, but not for the rest of the world. And, we can't really apply what we learn from Europeans and then like use it for other populations, because as much as we are all one human race, and we are also different in terms of we really need to actually understand these differences so that everyone gets the treatment that's right for everyone. So we really can't generalize, and at the same time, it's not saying that we're different. We're all human beings, but we really need to understand all of us, not just a subset of us, to really have equitable healthcare and equitable understanding of what's going on. And in this graph, you can just see these are all these studies in genetics out there. And the red represents all the studies done in patients of European descent. And then the rest are all the other groups in the world. And I think this really has to change. We are, as a community of physicians and researchers, this has been a really strong message in the last couple of years. We really have to stop just doing these very sophisticated genetics and genomic studies only in one population, because we're gonna really not understand the whole picture. So this is just an invitation to really understand why getting involved in research is so important. We need to all be represented so that we all benefit from modern science and like all these treatments that are coming out. So that's why we're still not fully understanding what the genetic underlying risk of the drivers of disparities is just yet. I think there's a lot to be said. Having said that, I still don't want to undermine. I mean, genetics is just one little piece, and you know, it's not actually it really is not. It's not going to dictate your life at all. I think that's also the beauty of lupus, and it's like you have so much power to actually override your genes and actually take care of yourself. But there's other things that really make the disease worse that we know. There's a lot of evidence about this too, and I don't want to undermine it. So there's the social determinants of health that actually make any disease worse. I mean, these are pretty much make any chronic disease not do well if you don't have access to care, if you're poor, if you're experiencing, you know, a lot of trauma in your life or stress. And we know that stress in particular is the one thing that triggers the immune system. So of course, if you're dealing with life in a million different ways, that's gonna really hurt your disease process and your overall health. We also have evidence that adverse childhood events actually have been a trigger for just lupus to come forward, to manifest itself, and things like that, and as well as mental health issues such as depression. But not only that, but also if you are a minority population that you can't really access, you don't really have your basic needs covered, you're probably not going to live in the best environment, and you have a higher chance to be exposed to toxic chemicals and to air pollution, things that we know that also trigger the immune system and maybe, you know, making lupus worse. So there's all these also another unaccounted factors that could make disparities are what they are. So I think it really is a true combination between disease biology and also what we're exposed to in life that can really fill the picture here. And I was just mentioning, well, the importance to participate in genetic studies to try to understand, but also because we know that lupus is so different. And again, I don't need to tell you guys that. I think we all know that every person is its unique universe. It has been really challenging to perform clinical trials in lupus. I think lupus is this big umbrella where we are putting a lot of people together, and it's kind of like putting, this is, I like this slide because it's the example. For example, let's say that there's like 6 different types of lupus that we're all putting all of them together. And then we're gonna try one medication that is gonna work in just one group, but we're giving the treatment to everyone. So it's just like literally just doing like a roulette to see if we get to the right target, and only in a particular group of people. So it's really hard to do this and then end up with perfect alignment of the right group of person with the right biomarker, with the right medication. And that's why we have more than 10 clinical trials fail in lupus approximately every year. Is we really are trying to be better at really just doing smaller studies targeting people where the medication might work. So it's a combination of trying to identify certain pathology or different pathways that are active in one group versus not the other, and then just try that medication in that group of people to see if it works. And I think there's a lot of effort in utilizing genetics, genomics, biomarkers, blood tests, immune mediators, anything we can try to infer as to where we could target things appropriately. But for that, we need everyone involved. We need all the lupus, all the different types, not just one, to basically come forward and really start trying to make these clinical trials work. And we have a beautiful example that this can happen. The Embrace trial was a very nice clinical trial that was done last year, where they really wanted to involve more of the African American community that was underrepresented in clinical trials before, and they did it. It was totally doable. So I think that the one message of this trial is that we can get everyone involved. It's not as difficult as people sometimes think. There are some barriers to that, but basically showed that it worked just as well. And there was actually a few more responders when there were some other clinical factors. For example, if you have double-stranded DNA antibody positive, the drug belimumab, called Benlysta, which some of you might have heard, works for patients of African American descent. And this is all to say that we can do a better job in including everyone in clinical trials, and there should be no excuse for not doing it further down the line. And with that, I think I want to say that I'm part of this great effort of many clinicians, many patient advocates, many researchers that we really want to understand, not only understand the health disparities, but like physically dissolve them. You know, we want to really make sure that everyone has the best care and the best outcomes in lupus. And that involves studying a diverse population to really understand what's driving it at the level of molecules and cells. And hopefully that will lead to what we want, which is personalized medicine, treat you for who you are as a whole, and really target your disease process, not like you under this umbrella of a million possibilities. And with that, I'm sorry if I extended my time, but I will happy to take any questions.
Thank you, Dr. Lanata. We do have a question that is coming from the Facebook live stream, and it's from Wanda. And Wanda asks, is there an effort to explore minority communities to narrow down key markers for the propensity to get lupus?
I am sorry, for some reason, could you repeat the question again? It really broke a little in terms of the sound.
Yes, it said, is there an effort to explore our minority communities to narrow down key markers for the propensity to get lupus?
There are a lot of efforts. We are part of one. We're funded by the CDC, the Center for Disease Prevention, where they've basically given us a task to really study a diverse group of lupus patients. I haven't really presented the study or the data just because of time, but we are really going into just an in-depth study of minorities at that level, at a very, very, very deep level, to try to actually come with biomarkers of disease heterogeneity. It's a technical term, but yes, to really try to look at these things that really could infer the differences to target them better and to compare it. So we're actively, we have a few papers that came out last year, and I think there's a lot of work to really see those pan out. But there is a lot of effort for that. Yes.
Thank you, Dr. Lanata. There's one more question here. This one, if you don't mind translating into Spanish.
Mm-hmm.
Historically, Hispanic and Latinx communities tend to have a preference toward natural remedies and can be wary of taking some of the prescription medications for lupus.
Mm-hmm.
How do you approach this preference in the doctor's office and respect the cultural influence of Hispanic and Latinx communities?
Yeah, I love that question. Thank you so much. Shall I translate it in Spanish?
Yes, thank you.
La pregunta es que tradicionalmente las comunidades latinas o hispanas también trabajan mucho con la medicina natural o tradicional y cómo esto puede ser incorporado, creo que o utilizado tratando esta enfermedad, ¿no? Y creo que shall I reply in Spanish, English first? I'll do English first and then Spanish. So I love this question because it's something that I'm deeply interested in lately. And I think the one message I want to say is that knowledge is knowledge. It doesn't really matter where it comes from. And if it's good and healthy, I take it in all sorts of ways. I think there has to be more space for that in the clinic. I'm fully on board with that. And I think there's so much things that are common sense and natural that help lupus and that they totally should be incorporated, especially to respect what one believes and thinks of their own health. So I think that is primordial. And then I think I just want to remind people, which people forget, that half of the medications that we have for lupus come from plants. Plants have been our first pharmacy, and we are actually utilizing compounds that are manufactured in plants, such as like hydroxychloroquine, that's plaquenil, comes from the cinchona tree, and mycophenolate, which some of them that comes from a fungus. These are all natural, actually, products that we've actually, leveraged from nature to give to you so that your disease can be at least tapered down. And I think there's a role for all forms of medicine. Everything is medicine, and there's a need sometimes for our medications. Thank God we have them. Thank God we can offer you that. And then there's like all these other things that are equally important, equally vital. So that's kind of my approach, and I'll try to answer in Spanish. Me encantó la pregunta, es algo que estoy pensando activamente de cómo incorporar cada vez más en mi clínica. Creo que es importantísimo traer las perspectivas de todos los pacientes en términos de qué es bueno para su salud y qué quieren incorporar en su salud. Y hay un rol para todo. Toda medicina es buena, no importa de dónde viene, si es que es medicina. Y creo que trabajar con sus doctores para poder incorporar todo es lo mejor. También quería hacerles acordar que muchas de las medicinas que ofrecemos en la clínica vienen de plantas. Son moléculas que hemos descubierto de la naturaleza y ahora las podemos como sintetizar o ponerlas en una forma mucho más efectiva en pastillas, pero no se olviden que la primera farmacia siempre ha sido plantas y que la mitad de nuestras pastillas como hidroxicloroquina o micofenolato vienen de ya sean hongos o plantas. Y a veces hay que simplemente ver todo como medicina y hablar mucho con su doctor. Pero creo que es una muy buena pregunta. Y creo que hay mucho más espacio para integrar las dos cosas.
Thank you, Dr. Lanata. Estela? Or Juana?
Okay, thank you, Dr. Lanata. We don't have any more questions then? No, right? Our next speaker is Dr. Jillian Rose. Dr. Rose is a director for community engagement, diversity, and research at Hospital for Special Surgery. Dr. Rose plays an integral role in the HSS Community Health Needs Assessment and Community Service Plan. Since August 2005, Dr. Rose has occupied a leadership position in managing rheumatology programs at the hospital with a focus on 2 national peer support and education programs for people with systemic lupus and their families. Please welcome Dr. Rose.
Thank you very much. Thank you for having me. And thank you, Dr. Lanata, for a very wonderful presentation that was information-packed and filled. And so we thank you for that. I'm going to ask whoever is sharing their screen to stop sharing so that I can share.
I apologize.
No worries. Thank you. So I'll start sharing my screen. I appreciate that wonderful introduction, and I appreciate the opportunity to be a part of this program as well. As I start sharing, I just want to acknowledge Priscilla Terrell, who is our lupus line and Charla de Lupus program manager. And she was supposed to be here with you today. However, she will not be here today because she's attending a family wedding. So I am filling in, and I hope I do her slides justice at this time. So let me pull up that presentation and start. All right, so here we go. I'll talk with you a little bit about serving the Hispanic and Latinx community. And it's important for us to understand that Dr. Lanata really outlined some of the clinical manifestations as well as disparities, including some of the social determinants of health issues that we face in managing, treating, and supporting lupus patients and their families. It's very important for us to understand that we have a voice in this conversation and we want to hear from you. This is not just about the research and the treatment, because without you, we are not effective at doing that. So our Charla de Lupus and Lupus Chat program that I'll talk about today is a really culturally tailored program that look at communities, integrate communities, assess the needs of communities, and then provide intervention not only for our patients, but for our clinicians, clinical guidelines and templates to follow on how we treat patients with a cultural specific lens. And so I'm happy to share these programs with you today. I'll talk a little bit about Charla. I'll glaze over some health disparities because it was well covered today. And most of all, I want to talk a little bit about some of the resources that are available to you. Sometimes the story about the lupus journey may seem grim, but it's not. You really have a voice, and there's some really excellent resources out there to support you on this journey as well. So the Charla de Lupus Chat program started in 1994 by Hospital for Special Surgery in New York. We are a national program, so you can access us from anywhere in the world, anywhere in the US and anywhere in the world that you are. Charla is a unique national program for people with lupus and their families, providing peer health education in both English and Spanish, right? One of the things that we understand about community is that one size doesn't fit all. So for this program, we did a community needs assessment, and people indicated to us, especially people who identify as African-American and Hispanic, they said, we need you to come into our communities. We don't trust going into some hospitals or clinics, and we want to see people who wants to serve us and have our best interest in our communities. So Charla has several components. The first component we have is individual support. We hire clinical social workers as well as people with lupus to provide eye-level care for patients with lupus in our clinics as well as clinics across New York State. So we're able to be in the room with the doctors. And I'm happy that question came in as it relates to traditional medicine, because one of the things, why are we there in the room with the doctors and the patients? So many times patients get into the room with their doctors and they say, yes, 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 that's perfect. And then they come out to our health educator who is bilingual and bicultural and say, you know what, I'm going to DR and I'm spending 3 months and my grandma have all these medicines ready for me and we are going to cure lupus. Meanwhile, we have Cytoxin schedule, we have Benlysta infusions. And so you, yes, the doctor, but because you don't feel that you have that power for a shared decision-making conversation. And so part of what we have done is to provide a peer health educator that not only talk with our patients, but can broker that relationship between the doctor and the patient to talk about what traditional medicines work for you. Fine, you're going to DR. We're happy that you're going. How can we also do some of the traditional medicine, but how can you also receive your infusions while you're there? How can we partner with clinicians that are in the places that you're going to? But it's important for you to have that conversation with us and to bring that up. There is a place for you to have that conversation. So we want to empower you to share some of the things that you're doing, because there's no one size fit all. Things can be coupled together for your benefit, right? We also knew that for us, it was important for us to not only talk to individual people. People wanted to get together because so many people have never met a person with lupus, and they wanted to get together and talk about their challenges, what works for them, and especially our parent, caregiver, and guardians who were struggling. You know, some who had 2 jobs and couldn't get to the many appointments for their teenager or adolescents. Some people who just couldn't get off of work to come into appointments. They wanted a place where they could meet together, talk together, and be supported. So we started the Charla support group back in 1994 as well, and we've been going strong since that time. We have over 300 members who are a part of our core group, and a list of about 1,500 members who are actively involved at various levels with our programs. COVID-19 is good and bad. It has allowed us to make our support group virtual, so you can join us. It's an open group. Just give us a call and we're happy to connect you with other people with lupus. We also have a telephone line that's both in English and Spanish, where you can meet other people with lupus who've had the illness for 20, 30 years. You can talk with them. You can talk with them about issues around. Just this morning, I matched a client who was going for a kidney biopsy and had no clue what to expect with one of our peer health managers. And that person was able to get on the phone and get some insight about what should I look out for, you know, what's going to be important about that appointment, what to expect. And it was a very important conversation to have for a person who have never experienced that before. We also do a lot of community engagement. We do about 50 presentations a year throughout New York City and across the country. And we're invested in education and awareness simply because there's so many myths out there about lupus. And so having credible information at your fingertips, not only in English, but in the language that you can relate to, in the language that your family can relate to, and with a cultural lens that acknowledges, if we're talking about something like nutrition, and we're saying, oh, go to Whole Foods. Whole Foods is like our, you know, organic supermarket here on the East Coast. I don't know what it is on the West Coast. Whole Foods is not down in the Bronx. Right. And so some of the neighborhoods that we serve don't have opportunities for fresh foods and fresh fruits or farmers market. And so it's important for us to talk about, how can you make a nutritional meal from the bodega? How can you put together something from McDonald's or Burger King where it's going to cost you $4 or $5 rather than a $10, $12 salad? Right? We are very realistic about the social determinants of health and places that people work, live, and play, and how we can tailor interventions in medicine. And so that's part of what our Charla program is about. These are some of our participants. We have a lot of fun together, not only in person, but online and virtually. One of the things that we love is our peer health education programs, because you can pick up the phone and talk with a teenager. You can pick up the phone and talk with a parent. You can pick up the phone and talk with someone who is a young adult moving into going back to work and being successful at their careers. So at any juncture across the developmental spectrum that you find yourself, there is support, education, and materials that you can access to navigate those waters. Our services, as I mentioned, are bilingual, and I want to share with you that our educational materials and resources are created with our patients. Many of them, many of our clients came in and they said, this doesn't work for us, this high-level language. We want language that is plain language that we can explain to anyone about what lupus is. So our materials and our resources are created in partnership with our patients as well. And like I mentioned before, very culturally specific. Some of the disparities that we do see and we acknowledge in this space that was shared with you before is that lupus disproportionately affect people of color, right? Especially Latinos or Latinx communities, African Americans and Asians. And we know that issues around higher disease severity, more lupus complication and higher mortality rates are things that are a part of the disparity picture for people who are impacted from communities of color. One of the things that we pay attention to is the lack of access of appropriate care. So in the face of disparities, in the face of not having genetic predispositions, as mentioned earlier, there needs to be some type of continuity of care for people to understand what they're supposed to do. What do I do now? How do I manage this illness? And too often our communities are disproportionately affected by the ability to go in and access specialists who are competent in serving them. It's important for us to understand that you can pick up the phone, call one of our organizations, and find access to care points that are going to serve you. We know that there are many rural areas across our country that don't have a rheumatologist. However, our programs really work hard to ensure that we're able to connect lupus patients with appropriate services across this country. And so we're able to help you to open up those access points, advocate for benefits for you, and connect you with foundations and organizations that have grants and fellowships that's going to help you get that access to care piece as well. We also look closely at issues like transportation barriers and lower socioeconomic status. And I'll talk a little bit about some of the resources that we do have that we like to share with our clients that you can access to combat some of these disparities as well as these social determinants of health. The goal of clinical trial and as you heard earlier, there is a deficit in terms of people of color, especially people who identify as Latinx and African American. Latinos represent 16% of the US population, but only 1% of clinical trial participants, right? And African American represents 12% of the US population, but only 5% of clinical trial participants. That is not your fault. I'm here to tell you that that is not about you. That is about the history of our nation that's provided care that's been disproportionate, discriminatory, marginalizing, and downright put the safety of many of our patients, right, at risk. We know the studies, we know about Tuskegee, we know about the reproductive health studies that didn't go well for women. It's important for you to understand that as we are in this space looking at a cure for lupus, we do need your partnership. It's going to take some give and take. It's going to take some trust on your end and some trust and proof in the pudding on our end as clinicians. I really want to invite you to partner with your local clinics, your local academic centers, your local doctors to talk about and learn about, well, what is this clinical trial about anyhow? How do I get educated about it so that you can make an informed decision about your participation and not just depend on, some of the things that you've heard about that happened before. This is something that really concerns you and your community. So I want to implore you, we need to do better as clinicians, and all across the country, we advocate for better treatment of patients, better education, and that partnership where patients are helping us to create protocols for research that really serves them and really gets at issues that are affecting them. So I want to invite you to learn more about research. Call us up, call any of us on this panel or our programs so that you can learn more about how to get involved, not on our terms, but on your terms, what makes you feel most comfortable. But I implore you, get the information that you need to make the best decision. A little bit about lupus in men, right? And so we did a study with 110 men with lupus last year, and over 50% of our study, the males in our study identify as Hispanic Latinx people. Three things that we found out about this population. One, 50% of them identified that they suffered from depression and anxiety. Two, 50% of them identified that they worry about their future. Worrying about their future had two components. One, the component around culture and expectations as providers and their own, what we usually call machismo or masculinity, and how that is something that's threatened by lupus. We also found out that 60% of that population had concerns about sexual health and never speak to their doctors, right? And they had issues around impotence. They had issues around lower desire for engagement in sexual intercourse, as well as challenges with talking with their partners that often a lot of these challenges were brought on by medications they were on. It's important for us to understand, although we know that women of color are disproportionately affected, men and men of color as well also face severe barriers with treatment, diagnosis, and mortality with lupus as well. And we want to encourage our males with lupus to reach out to us. We want to hold your hands through this process and support you as well. I'm going to skip over this slide because we did talk a lot about, the male piece, and I want to get to some of the resources before we wrap up. LupusMinder is an app that was created for lupus self-management, and it was created by people with lupus. We had an idea like, oh, let's create an app, it'll be great. And our patients came in and said, it'll be great, but not in the way that you're thinking about it. So we had people from the lupus community talk to us about how they want to self-manage symptoms. They added photo options to the app, communication with physicians, how to track their appointments, and how to link it up to their electronic medical record. So you can download that app on iOS or Android. It was created for lupus patients by lupus patients. Again, I want to encourage you, if you need that support, to reach out to our Charla line. It's important for you to understand it's not just about what we can do for you in New York. We are an organization that reaches out nationally and collaborate with different academic health centers and rheumatology bodies so that we can provide the best access for our patients. Also, I want to point out that we have free materials for you, both in English and Spanish. Some of these materials were created by our patients, especially the ones that you see that are very colorful on the screen. Those booklets were created by our patient. This one is called For Inquiring Teens with Lupus, Our Thoughts, Issues, and Concern. And this was from the perspective of many of our teens who identify as Latinx. As I wrap up, I want to leave with you some national resources. Latin therapy is one of my most favorite resource. Each of us are on this journey of coping with our chronic illness, and having that mental health and psychosocial support is so critical to our wellness picture, and it's really a part of our health. So I also want to encourage you to use those resources because they're very credible and they can link you with the things that you need to ensure your a healthy mental health status. Catholic Charities all across this country is one of my favorites as well, and you see the number there. The Lantern program, Lupus Asian Network, is also another program that can support people of color dealing with lupus. Lupus Line is another program that we have as well that can support people with lupus across the country. Lastly, I want to point out some of the Lupus Foundation and Lupus Research Alliance and Lupus LA, all organizations that we work with and partner with. And I want to leave you with one thing about COVID-19. We have currently a national study going, and we want to provide an invitation to you to participate. Our focus on this study is to look at the psychosocial impact of COVID-19 on people with rheumatic illnesses, with a focus on Latinx and African American communities. So if you have a chance, log on, fill out the questionnaire, and let us know how COVID-19 has impacted you so we can think about how we intervene on the psychosocial side of helping our lupus patients through this pandemic. Thank you.
Thank you, Dr. Jillian Rose. And last but not least, Mr. Dojo Aguilar. Dojo is a patient engagement liaison with GSK. He holds a master's in nursing and has been traveling around the US spreading lupus awareness, and has a passion for improving patient-doctor relationships by helping those living with lupus break through social barriers and stigmas. Welcome, Dojo Aguilar.
Thank you so much, Juana. Good afternoon, everybody. Well, first of all, I just want to thank again Dr. Lanata and Dr. Rose. I don't know how I could follow them. That was amazing, amazing presentation from these two amazing women. And I could close this out and give justice to this wonderful event. And Juana from More Than Lupus and Looms for Lupus have come up. So I did not, I purposely did not prepare any slides because I just really want to talk to you as patients living with lupus. So I know a lot of, about lupus and clinical trials have already been covered by Dr. Lanata and Dr. Rose. So I just want to help you remember, I think there's three important things that as a lupus patient, how can, especially those in the minority population, that how you can really improve your relationship with your healthcare team. As we know, being a minority myself, sometimes it's very hard for us to really establish that trusting relationship with our healthcare provider, right? Because number one is usually it's hard for us to really communicate as a patient what we feel, okay? And whether it's just because of our cultural upbringing or sometimes there's different factors. So one of the things that I would encourage you as a minority lupus patient is really be open and honest with your physician. Talk with your physicians topics that may be uncomfortable for you or you haven't shared with them at all, right? Because what's important in lupus management is not just sharing with your physicians, just the regular clinical symptoms like the flares you have, like the pains you experience, but really also sharing to them how is lupus really affecting your life, okay? Because that's also the psychosocial impact of lupus have on the patients. And as we all know now, even as we live now in this telemedicine environment because of COVID, the more and more that appointments with your physician can be very, very challenging. But make sure that you really talk to your physician topics that you may be uncomfortable with. I know Dr. Rose mentioned about this, the importance of shared decision making. That is really very, very key, my friends, because um, if there are things that are important for you as a patient that you haven't shared with the physician, and your physicians are not mind readers, right? You have to let them know how lupus is affecting your life. And so the more and more information that you can share to your physician as a lupus patient and what you feel and how it's affecting your life, the more and more that your physician can really come up with a treatment plan that you actually share with them, because that's something that is maybe personal to you. And so the more that you can come to that point of having a shared decision making with your healthcare team, the more likely that you will adhere and be compliant with the treatment plan that your physician will have for you as a lupus patient. Okay. Second thing that I would encourage our patients here is track your symptoms. Very, very important, because as we know, the symptoms of lupus waxes and wanes. And I don't know about you, but I'm a very forgetful person. I don't even know what I ate yesterday, right? And so knowing that symptoms of lupus waxes and wanes, and let's say on the day of appointment, you actually feel good about yourself, right? And so when your doctor asks you, how are you doing today? Most likely your response, and this will actually be my response also, like, I'm actually feeling good today, doctor, right? Even though that last week or a couple of weeks ago, you may had some flares, okay? So the important reason why you need to track your symptoms is you really want to paint a picture with your physician, a pattern of your symptom over a period of time since the last time you saw them. And why is this important? Because so that your doctor will have a better understanding and assessment whether your lupus is active or not. And really, that's one of the ways that your physicians can assess better whether your lupus is active, by really, having a better picture of your symptoms over a period of time rather than just what you can remember during the time of your appointment. So very, very important. There's different ways now, as what Dr. Rose have shared, that LupusMinder. There's also, we actually at GSK, we have come up with a patient program called Us and Lupus, USIN lupus.com. It's actually a free program that you can sign up on our website, or you can also like our Facebook page, and you can actually get this free reference symptom kits. There's a lupus journal, a lupus checklist, a lupus dictionary, and all sorts of resources that will be mailed to you once you sign up, and it's all free for our lupus patient. And the third important thing that I always emphasize to our patients here is really connect. And I know that's still a challenge, especially in a minority population. And I've even seen yesterday during one of the events that I attended that some patients have a hard time connecting either with a support group or a patient advocacy organization. And we have, of course, the Lupus Foundation, which is a very, very Foundation of America, with the LRA, More Than Lupus, Looms for Lupus, Hospital for Special Surgery. These are great resources for you. And so I would really encourage you, connect, be part of a support group. I could not overemphasize enough the importance of being part of a support group. Attend educational events like this, attend a lupus walk or a lupus run or whatever it is. And what's also important is invite your friends and families to be part of these events, right? That's actually one of the ways that, your friends, your family, your coworkers can better understand what you're going through as a lupus patient. Because I've heard this most of the time from lupus patients, like when you tell your friends, they just say like, oh, that's all in your mind, that's, I don't think you're sick. Because lupus patient, you don't look sick from the outside, right? It's all those inflammation that happens on the inside. And so the more that, not just you, but your family, friends, and coworkers are educated about lupus, the more that they could understand you as a patient living with lupus. So lastly, before I wrap this up, is I just want to share with you some of the amazing things that our company is doing to really highlight our efforts working with the different patient advocacy organization towards addressing some of the health disparities in the minority population. So first of all, we are so proud as an organization at GSK to support LFA's Alpha Project. And Alpha Project stands for Addressing Lupus Pillars for Health Advancement. And the goal of this project is really to reduce the time to diagnosis, which we know averages about 6 years. I know this situation is simply attainable, and we must reduce the time of diagnosis and the associated burden of lupus. Another thing that we are collaborating with the Lupus Foundation of America is we are strengthening our reach into communities with women of color and minorities who are disproportionately affected by lupus by supporting LFA's multicultural efforts and soliciting LFA's input on how we as a company can do a better job. Third, we are also collaborating with the Lupus Research Alliance on strengthening our reach into communities with women of color who are disproportionately affected by lupus by supporting LRA's multicultural efforts and soliciting the LRA's input on how, again, as a company, we can do a better job. And equally as important, which is really, we put a lot of importance to this. That's why we partner with a different patient advocacy organization around education, is we really want to equip our patients and to hopefully improve their dialogue between them and their healthcare team. This is very, very important because research have shown that, physicians may not perceive when patients are suffering, right? And we have been honored to partner with, the different patient advocacy organization to bring our Us and Lupus resources to more than, I think this year we have done about 150 of these virtual events across the country. And although we cannot engage face-to-face for now, we're still making these valuable resources available to you all virtually. So Us in Lupus is a program that helps people with lupus to have more open and honest conversations with their healthcare team. And we actually are very excited to share with you that we are doing such like a refresh or rebranding of our Us and Lupus website coming this September with a new website, a new app, and several new online resources to empower people living with lupus to take a more active role in the management of their disease. And last but not the least, I want to thank and commend all of you, those people living with lupus, your family members and caregivers who are participating in this virtual event. I want to thank, Kelly from More Than Lupus and Juana and Estela from Looms for Lupus. Your strength and all of you as patients is what keeps us going as a company to help you live your best every single day. You have our commitment as an organization that we will continue to invest significantly in our lupus research and development program, as well as support the efforts of our patient advocacy organizations in this space, whether it be advocating on the Hill for increased federal funding for research or supporting efforts to bring the patient voice into clinical trials. We will be there every step of the way so that a new era will dawn for lupus treatment. So thank you again, Kelly and Juan and Stella, for allowing me and GSK to be part of this very important event.
Thank you, Dojo. Thank you very much for all the information that you've provided and that you've provided all the time. At this time, we would like to open it up for pre-submitted questions and questions from the live audience. We will do our best to respond both English and Spanish for those who are watching and speak Spanish only. So, Ms. Kelly?
Yes, we have quite a few that have come through. The first one is for Dr. Rose. Ms. Jillian, you offer programs specifically for Hispanic and Latinx children and teenagers living with lupus. Do you offer online programs for children and teenagers as well? And how do you incorporate the entire family unit, which is important to Latinx communities, into your resources?
Well, thank you for that question. One of the things that we know about lupus is that many of our young people are diagnosed earlier on, and there's not a lot of support for those populations, our teenagers, our teeny boppers. It was important for us to go into community and partner with local hospitals and not compete for patients, but just think about lupus communities and where people live that needed that support and service. Due to COVID-19, like I mentioned before, which was a real blessing for us to move that education to a virtual space. So yes, you can now access the information for teens and young adults from our monthly support group. And I know one of my colleagues is on and would paste the information in the chat box to link to our support group. And so you can have that information as well. We have a monthly support group every third Thursday of the month for teens, young adults, their parents, their guardians. They can also invite their friends to the session. The first hour is given by a rheumatologist, a talk by a rheumatologist that address some symptom of lupus. We're going to do lupus and lab tests coming up in our September program and how to look at your labs and what's important about that. In that presentation, we'll also talk about the mental health component and give tools and skills on how to deal with that as well. We then break up into parent group and teen group because we know across that spectrum, there are different issues and concerns for those populations. And that's how we then integrate the opinions of our parents, our children, our guardians, families, and friends into our intervention.
Thank you, Dr. Rose. The next question is for Dr. Lanata. And this is about diet, traditional Latinx Hispanic diet. Have you seen there being influence in symptoms or symptoms dissipation if Hispanic Latinx individuals try a vegan or more holistic diet?
Oh, diet is such an interesting and fascinating question. And it's a very tricky one. All I can say is that I have zero evidence to support anything I have to say about diet because we are such unique humans that any large scale study about nutrition has been really frustrating to really have strong conclusions. I think, but there's like some common sense things that we don't really need a lot of evidence to say about how we should take care of our bodies. And I think the best thing, I mean, you're your own, no one else will know what feels and, lands well in your body than you. So what I have with my patients is we know that diet definitely is a big part of how you are going to take care of yourself. It's not only the diet taking care of yourself, but the diet that also feeds all your microbes and your microbiome that also is very, very closely related with the immune system and how you're going to absorb medication. So it all starts with good nutrition. And there is something to be said about sugars. Really, there's nothing really good that comes out of sugar, just for sugar's sake. So before even attacking like a low gluten, low lactose diet, I really stress on the point of really trying to just eat food. And that sometimes is really hard. But having an approach of just really incorporating in your diet, a lot of vegetables, leafy greens, nuts, olive oil, fruits, a lot of like the healthy proteins in the vegetable world, which are, all the beans and lentils and it's a very long conversation about diet. And then, you know, what I tell people is try it out. You do your thing, but try one thing at a time and see how you feel. So if you want to eliminate gluten and see if that's something that works for you, give yourself a trial where you only eliminate gluten, see how you feel after a month. And then I do have to say there are some people that swear by it. There's some people that, you know, nothing happened. And it's just such a personal question. And I think it's an own individual quest as to figuring out what actually helps you with dealing not only with lupus, but fatigue, energy. I think that's also very linked to nutrition. So it's a whole new discovery mode for each patient that you have to take it as a, you know, as an adventure of trying to figure out what will be good nutrition-wise to your own body. So it's a difficult, I wish I had like, you know, general recommendations for everyone, but everyone is their own particular self.
Do you mind translating a response?
Sure. La pregunta era qué podemos decir sobre cómo la nutrición influye en la enfermedad de lupus en general, y lo que estaba diciendo es que la nutrición y la dieta es sumamente importante, es una de las cosas, además que tenemos un montón de control, ¿no? Podemos hacer mucho con la dieta para mejorar nuestra salud, pero no tengo así como recomendaciones con una evidencia científica muy sólida, porque es muy difícil hacer cosas muy generales sobre algo tan particular y personal como es la dieta. Las pocas cosas que puedo decir que sabemos es que las azúcares no son muy buenas y que tratamos de ir sobre una dieta como industrializada, donde toda la comida sale de una caja o de una envoltura, a una comida hecha en casa de vegetales y legumbres y comida de verdad, de la naturaleza, que una la hace en casa sin todo lo que es producido por la industria, que lamentablemente tiene cosas con muchos químicos y cosas no procesadas que no son muy buenas para la salud en general. Y una vez que entramos en una dieta más balanceada, de comida más natural y con menos azúcares y cosas industrializadas, hay personas que, por ejemplo, sí dicen que se benefician, como les digo, no tengo mucha evidencia científica, cuando dejan de comer cosas como gluten o como cosas lácteas, pero no es algo que es generalizable para todos los pacientes. Hay pacientes que dejan de comer gluten y la verdad que no pasa nada. Hay gente que deja de comer gluten y pues se sienten muy bien. Y es una avenida de exploración de cómo conocer el cuerpo. Solamente uno va a ser la persona que va a poder descifrar qué es bueno para uno. Y lo que les digo a mis pacientes es que traten una cosa a la vez, porque tienes que darle tiempo. Entonces, si quieren ver si es que el gluten no les cae bien, hagan un periodo en que un mes dejan de comer gluten, pero solamente traten de eliminar, se llama dieta de eliminación, ¿no? Una cosa a la vez para ver cuál funciona. Entonces, si después de un mes no pasó nada, bueno, traten dejar lácteos y ver si es que algo cae bien o cae mal, pero no hay muchas recomendaciones duras, pero es más que nada conocerse a uno mismo y ver qué le cae mejor.
Thank you, Dr. Lanata. Another question has come in regarding clinical trial barriers if you are or have tried Benlysta. The question is, why haven't we been allowed to do clinical trials when on Benlysta? I've tried numerous times. I'd like to participate.
That's for me. Yeah, I mean, the only thing I can say is like what we do in the scientific experiment, which just like us trying gluten in diet, we just want to try one thing at a time and having some sort to be basically able to say whether something worked or not. And for some of these trials, you need to basically have everyone be at least on the same medication when they start the clinical trial, or not be in medications that act similarly to the new drug, or things like that. So it is difficult, and it's not only you that suffers with this issue. I think like it's really hard sometimes to enroll patients, because sometimes it's really hard to get these qualifications to enroll because of all these different medications and washout periods. You have to stop the medication for a period of time, etc., to be able to qualify for it is tricky. But having said that, I'm sure the clinical trial will come where you are available and like be the perfect candidate. So don't give up on trying to figure out where can you be part of the research help. But it's just a little bit like how the experiment is set up.
Yeah, I just want to add to that, I think it's important, even when you're exploring clinical trials and what's going to work for you, always look at the inclusion and exclusion criterias, right? That's going to give you a clue about what you can participate in and what you can't, because of the nature of the study, as well as your own safety. So looking at the inclusion and exclusion criteria really help you to decide. So if you go to clinicaltrial.gov, you'll see many studies that are being conducted, or if you reach back out to your local healthcare facility or doctor to discuss what's going to work for you, and sort it by looking at inclusion and exclusion criteria.
Yeah, that's a great point. I mean, the last thing we want to do is give you more medication that are toxic and then give you, immunosuppression side effects and things like that.
And Kelly, if I also could add to that is, I know that with the LRA, Lupus Research Alliance, they actually have this buddy program that if you're interested in clinical trials and you haven't been a part of it, but you have a lot of questions, you have this fear and anxiety, they actually have some peer buddies that, they could partner with you so that all your questions will be answered if you're interested in getting involved in clinical trials.
Yes, thank you, Dojo. The PALS program is incredible, and it's exciting to see it come into fruition and continue to develop. I have, there's a question that can be answered by both Dr. Lanata and Dr. Rose. Do you feel that there is a lack of awareness about lupus, just about the disease itself and flares and medical treatments among Hispanic and Latinx communities?
Yeah, you know what, I feel two ways about this. I think there's general information. There's, the Dr. Oz's and the different shows that put out, oh, and by the way, I have lupus, right? And so you get that kind of information. However, specific to Latinx communities, I don't think there's enough credible information. Right? I don't think there's enough access to credible information, because so many of our patients still come to us and feel like lupus is a life sentence. And that's why I mentioned to you, our team do about 45 to 50 presentations in communities, whether we're in schools, in churches, going into community barbershops, anywhere that we can find people who can listen and be educated and get credible information about the impact of lupus on these communities and the access points that they can reach out to. We really try to do that. So there's information out there in communities, but I think credible information about how lupus affects Latinx and African American communities, that's not so readily available. In addition to resources, and that's why it's so important for us to be here on this program today, resources and access to resources for Latinx communities are not readily available. We don't have enough information that's credible, that's translated, and that meet people where they are. Health literacy is huge. English proficiency is huge. Having things translated into Spanish is not just translation. It's really about looking at the dialect and complexities within cultures. And so looking at some of the nuances, people get information, but not what's specific to help them.
Thank you, Dr. Rose. The follow-up question would be for Dr. Lanata. Do you feel this lack of credible information has a negative impact on disease outcomes?
Of course. I think it's if you don't even know what this is, and it sounds like a really horrible word, and you lost hope, and you're paralyzed, you don't even know what to do. I think, and then there's like a lack of a relationship with a rheumatologist. We know that there's such a shortage of rheumatologists in most communities, and when it is a big problem. I think because the rheumatologist should be the #1 ally in trying to get this information across that's credible and accessible, and to actually offer the real panorama of a treatable chronic disease that for the most part can do extremely, extremely well. So I actually echo everything that Dr. Rose said. I think we need to do a much better job in just getting information is a lot of knowledge. Knowledge is power. Power is self-empowerment. And I think there's so much to be said about that in terms of outcomes. Yeah.
And for our Spanish-speaking viewers, do you mind translating?
Yes. Creo que las dos últimas preguntas de las cuales hemos estado hablando es sobre a veces la falta de información, y no solamente información, pero información real sobre lo que es la enfermedad de lupus y cómo se puede controlar o qué es exactamente. Creo que hay un montón de miedo, pánico, a veces pacientes sienten que es una sentencia de muerte, que no tienen cómo entender qué está pasando ni qué va a pasar. Y esta falta de información o falta de entendimiento por muchas barreras, ya sea por en verdad una escasez de reumatólogos, también no hay muchos reumatólogos, no hay muchos también doctores en general, aparte de reumatólogos que sepan comunicar y hablar de esta enfermedad. Y también que lo que hace es que haya esas comunicaciones donde puede haber un entendimiento más claro de que el lupus puede ir muy bien, y simplemente hay que hacer un montón de cosas, pero básicamente haciendo las cosas necesarias puede ser una enfermedad muy leve y puede ser una enfermedad crónica que se controla bastante bien. Y creo que hay un montón de trabajo en hacer en esa área, porque una vez que se establecen estos vínculos de confianza con un doctor y un paciente, entonces pueden ser un equipo para pues lidiar con lo que se venga y bien, y bajar los niveles de estrés, y también y la enfermedad va mucho mejor cuando eso sucede, ¿no? Cuando hay un buen equipo entre un doctor y un paciente.
Thank you, Dr. Lanata. The data that was provided during Dr. Rose and Dr. Lanata's presentations, will that be available? There are some viewers who would like to revisit that data and share that data.
Kelly, we can share that with you to share with the audience.
Thank you so much.
That's totally, yes.
Thank you. Then the last question that we have that came in, Dr. Rose, you actually addressed part of this when you were talking about how lupus can affect Hispanic and Latinx men with sexual problems. And the question is, and both Dr. Rose and Dr. Lanata might be able to address this, is it common for Hispanics and Latinx individuals to flare after sexual intercourse?
I'll throw that to Dr. Lanata.
No, I don't think that's true at all. I think having a good sexual life is part of life, and there's no evidence to suggest that you flare after intercourse. So no issues on that front.
I think some of the things that we have heard from our patients is issues around being tired, feeling fatigue after, and we do provide some guidelines and some tips. And I could link an article. Priscilla, if you can link the article in the comments, that'll be great, on lupus and intimacy. It provides some tips on, when your body is feeling fatigue, how do you engage in sexual intercourse? How do you prepare, whether it's resting, whether it's taking a warm bath, whether it's, prior sexual play, or just having intimate moments together when you are flaring and you're not able to participate in physical intercourse. And it provides you some real guidelines on how to continue to support a healthy sex life with your partners. So it's important to think about not only like, I'm having a flare. If you're having a flare, something else might be going on and you want to reach out to your clinician about that. However, we don't think that a healthy sex life flares lupus, but definitely some good practice tips around preparing for intercourse is going to be important as well.
Thank you for those points, Dr. Rose. Yeah.
Thank you both. That is it for the submitted questions from Facebook Live. Juana?
I'm sorry, what was that? I didn't.
That is it for all the questions.
Okay. Well, I don't think we have any more questions, but I want to thank everyone for joining us. If you have questions, you can still submit them, and we'll be more than happy to reach out to Dr. Lanata and Dr. Rose, and we will get your questions answered. We will post them on Facebook. And thank you for joining us. It's always great, and I'm always happy to be part of More Than Lupus. And obviously, oh my goodness, I was gonna say fiber fog, but it's a lupus fog. I forgot that I am with Looms for Lupus. Thank you so much, everyone, for joining us. Thank you, Dr. Rose, Dr. Lanata, and Dojo.
Thank you so much, Juana.
Pleasure. Thank you so much.
Thank you, Dojo. Thank you, Jillian, Dr. Lanata. We are so grateful to have all of you as part of this efforts to come together to bring this critical awareness to the often overlooked lupus in minorities health crisis. We look forward to continuing this work. It's not a one and done situation with these symposiums. We are committed to doing the work, to bridging the gap between the patient and medical communities, so that maybe one day we can say that all communities are represented equally. So thank you so much for your time, for sharing your insights, and we will be posting this video for everyone to view later. And there also will be a survey that is going to be embedded in the comment section of this Facebook Live. Please, if you're watching or you're streaming this later, take a moment, fill out the survey so that we know how we can best serve you in the future and what your thoughts were on this incredible symposium. Thank you so much. Take care and enjoy the rest of your weekend.
Gracias a todos y gracias por sintonizarse a esta junta por medio de Facebook. Y recuerden, si tienen preguntas, pueden poner las preguntas y nosotros vamos a tratar de responder las preguntas. Hablaremos con la doctora Lanata y a la doctora Rose. Gracias otra vez por sintonizarse y que tengan bonito día.
Muchas gracias.
Bye, everyone. Thank you.